neonatal screening. Before leaving the hospital, newborn should be screened for a serious and life-threatening condition. The optimum time for screening is 24 to 48 hours after birth. Screening and usually involves screening usually assessment for critical congenital cardiac defects, hyperbilirubinemia, congenital deafness, congenital endocrine disorder, congenital hypothyroidism, congenital adrenal hyperplasia, metabolic disorder, genetic disorder, hematologic disorder, sickle cell disease, beta thalassemia. The optimal time for screening is 24 to 48 hours after birth. Screening usually involves assessment for critical congenital cardiac defects, hyperbilirubinemia, congenital deafness, various genetic disorders like endocrine, metabolic, and hematological disorder. Condition to screen: method of screening, congenital, metabolic, or hematological disorder. Capillary Hill stick is used to collect dried blood spot sample on filter paper. Hyperbilirubinemia, bilirubin level, transcutaneous ulcer. Critical congenital heart defects, SCHD, simultaneous pulse oximetry of the right hand and foot. The pulse oximeter screen can detect hypoxemia from a cyanotic and or doctor-dependent congenital health condition. The screen is abnormal if the oxygen saturation is under 90% in either the hand or foot, or if after 3 measurements the oxygen saturation is 90 to 94 in both the hands and foot, or the saturation differs by over 4% between the right hand and either foot saturation. Congenital deafness, auto-acoustic emission, DAE, or automated auditory brainstem response, AABR. Examples of commonly screened genetic condition: congenital hypothyroidism, congenital adrenal hyperplasia, metabolic condition, phenylketonuria, homocystinuria, maple syrup immune disease, citrullinemia type 1, hemoglobinopathy, sickle cell disease, beta thalassemia, cystic fibrosis, classic galactosemia, severe combined immunodeficiency, SCID, glycogen storage disease type 2, pump disease, spinal muscular atrophy. Neonatal screening, also known as newborn screening, is a comprehensive health program aimed at the early identification of conditions that affect a child's long-term health or survival. Early detection, diagnosis, and intervention can prevent severe health problems of death. Here's a detailed overview tailored for medical professionals: characteristics, symptoms, and pathophysiology. Symptoms: most common conditions screened at birth are asymptomatic in the neonatal period. Pathophysiology: the conditions commonly screened for often involve metabolic disorders such as phenylketonuria, or PKU, and medium chain acyl-CoA, dehydrogenase deficiency, MCADD, endocrine disorder like congenital hypothyroidism, hemoglobinopathy such as sickle cell disease, and more recently severe combined immunodeficiency, SCID, and cystic fibrosis. These conditions can lead to severe developmental delays, growth issues, even life-threatening situation if not detected and treated early. Clinical presentation and diagnosis. Clinical presentation: most newborns with these conditions appear healthy at birth, which underscores the importance of universal screening. Diagnosis: screening involves various testing, including blood tests from a heel prick, hearing test, and pulse oximetry. The specific tests vary by jurisdiction, but are designed to be sensitive for early pre-symptomatic detection of the disease. Treatment: general approach. Treatment depends on specific condition diagnosis, but often involves dietary management, medication, or hormone replacement therapy. Phenylketonuria, PKU, dietary restriction of phenylalanine, congenital hypothyroidism, levothyroxine replacement, sickle cell disease, proleptic, antibiotics, vaccination, and sometimes hydroxyurea, medium chain acyl-CoA dehydrogenase deficiency, MCADD, avoidance of fasting, and specific dietary adjustment. Prognosis: general outlook. With early detection and appropriate treatment, many children with condition identified through neonatal screening can lead normal, healthy lives. Condition specific: the prognosis varies significantly among the different conditions, but is generally improved significantly with early intervention. Differential diagnosis table of phenylketonuria: elevated blood phenylalanine, dietary restriction, congenital congenital hypothyroidism, low T4 and high TSH level, levothyroxine and sickle cell disease, hemoglobin, electrophoresis, sickle cell test, prophylactic antibiotic, hydroxyurea, MCADD, low blood sugar, elevated C8, ACU, acylcarnitine dietary adjustment. Higher voice neonatal screening is crucial for early detection of serious conditions that are asymptomatic at birth. A heel prick blood test is a common method for screening, supplemented by hearing tests and pulse oximetry. Early intervention based on screening results can significantly improve outcome for many conditions. Protocols and conditions screened can vary by location, so it's important to be familiar with local guidelines. Understanding this aspect is essential for medical professionals, enabling them to support early screening programs and manage diagnosed condition effectively. So let's sum up what we have read. Neonatal screening. Before leaving the hospital, newborn should be screened for serious and life-threatening conditions. The optimal time for screening is 24 to 48 hours after first. Screening usually involves assessment for critical congenital cardiac defect, hypobilirubinemia, congenital deafness, endocrine disorder, congenital hypothyroidism, congenital adrenal hyperplasia, metabolic disorder, genetic disorder, hematologic disorder, sickle cell disease, and beta thalassemia. The optimal time for screening is 24 to 48 hours after first. Screening usually involves assessment for critical congenital cardiac defect, hypobilirubinemia, congenital deafness, various genetic disorder, endocrine metabolic and hematological disorder, congenital metabolic hematological disorder. Capillary heel stick is used to collect dry blood from spot sample on filtered paper. Hypobilirubinemia, bilirubin level, transcutaneous or serum, critical congenital heart defect, simultaneous pulse oximetry of the right hand and foot. The pulse oximetry screen can detect hypoxemia. The pulse oximeter screen can detect hypoxemia from a cyanotic and or doctor-dependent congenital heart condition. The screen is abnormal if the oxygen saturation is under 90% in either the hand or foot, or if after 3 measurements the oxygen saturation is 90 to 94% in both the hand and foot, or the saturation differ by over 4% between the right hand and either foot saturation. Congenital deafness, autoacoustic emission or automated auditory brainstem response. Example, commonly screened genetic condition, congenital hypothyroidism, congenital adrenal hyperplasia, metabolic condition, phenylketonuria, homocystinuria, hypocerebral disease, and hemoglobinopathy, sickle cell disease, beta thalassemia, cystic fibrosis, West group allocythemia, severe combined immunodeficiency, glycogen storage disease, type 2 pump disease, spinal muscular atrophy. Pituitary symptom motor consumer screen at birth, asymptomatic, pathophysiology. And clinical presentation most newer with this condition appear healthy, and diagnosis including blood tests, various tests, hair prick, hearing tests, and pulse oximetry. Treatment and general approach treatment depends on the specific condition diagnosed, but often involves dietary management, medication, hormone replacement. Phenylketonuria dietary restriction may depend on congenital hypothyroidism, levothyroxine replacement, and sickle cell disease, prophylactic antibiotic vaccination, sometimes hydroxyurea, medium chain acyl CoA dehydrogenase deficiency, avoidance of fasting, and specific dietary adjustment. General allow early detection and appropriate treatment, condition specific. Varies. Higher neonatal screening is crucial. Blood test, common method, early intervention, protocol, and condition.